Tonight, the CDC says cases of a dangerous fungus are rising quickly in the U.S. It's a form of yeast that spreads very easily. WBZ's Louisa Moller is live in Cambridge. And Louisa, I know you've been looking into this so that we can understand first the threat and then how to avoid getting it.
Well, Lisa, to put this in perspective, we all have things on our skin, bacteria, fungus, even this fungus. And if you're perfectly healthy, you may never know it. But the CDC is concerned because this is spreading in healthcare facilities where it poses a risk to the extremely ill. The CDC is sounding the alarm about the spread of a fungus called Candida auris in healthcare facilities. First found in the U.S. in 2016, infections have accelerated, doubling in 2021.
But really, it's these structures that invade and cut through our tissues.
Harvard Medical School and Mass General Hospital Dr. Michael Moller knows all about invasive fungal infections. He says auris spreads by skin to skin or skin to surface touch, often in hospitals and nursing homes, preying on the most vulnerable.
A healthy person may have Candida auris on their skin, not even know it. It's the person who's like advanced age, someone in a nursing home, someone with advanced diabetes or cancer. That person may notice a variety of infections.
It's also resistant to at least one kind of antifungal drug and deadly. CDC scientists say roughly 1 in 3 patients with invasive infections will die.
Is it that deadly for this vulnerable patient population?
So scary answer is yes. But it's the same percentage for any Candida infection that really is highly invasive.
Take a look at the CDC map and you can see where there were hundreds of infections in the past year. New York and Florida in bright red, for example. Massachusetts had just 2 clinical cases. Moller says the cases may be climbing because of people emerging from the isolation of the COVID pandemic.
We may have opened up the opportunity for Candida auris, but probably for other things too.
But that doesn't mean patients should be crippled by fear.
Wash your hands. The really simple measures, honestly, and just having that awareness that you just need to, just practice a little extra careful hygiene and just be aware of your environment.
So you heard Dr. Moller, very easy things to prevent the spread of this. Washing hands before you go in and out of healthcare facilities. If you're a healthcare worker, frequently changing your gown and your gloves. Live in Cambridge, I'm Louisa Moller, WBZ News.
Louisa, thank you. Now to